The problem here is that we've got electrodes, but the skin is not completely conducting electricity, okay? So you need to rinse it with water or alcohol or a gel. I'm not going to use the gel because, well, it might be a little bit discomforting for the patient. I'm going to show it with the alcohol, okay? So we've got our alcohol, we've got our paper napkin or whatever you can find. So you are going to rinse the places that you are going to place the electrodes, okay? I'm going to rinse the ankles, wrists, and the precordial area, chest, okay? So this will increase the conductivity of the electricity. The next thing that I'm going to do is femoral leads, yeah. So these are called the So all of these electrodes are called derivations, okay? That's the technical term for this. These are the extremity derivations. These are the precordial derivations, okay? So one way to place everything is to memorize everything, which I don't recommend because you are going to forget. The other way is that if you look to these leads carefully, you see some letters, okay? So for example, on the yellow one, you'll see a small letter L, which indicates left arm. On the red one, you are going to see a letter R, which indicates the right arm. For the other one, you are going to see a letter F, or, well, LL, that's also okay, you can read it like this. It indicates foot and left leg. And the remaining, the black one, it's neutral, okay? It's black, it's neutral, it won't just get anything, but you should place it. If you don't place it, then you won't have any ECG recordings. So, the only thing that I want you to memorize is to put this to the right ankle, okay? Got it? So, left arm. This is the electrode part, so you are going to put it inside the wrist. Again, this is the right R. This is the neutral one, remember? Which leg? Right, that's correct. Oh, you're wonderful. What a memory. So, when you place all the extremity leads, you are going to get some ECG recordings. Not complete, but at least something. So I'm going to obtain an ECG now, and I'm going to show you. Well, that's just a partial one. So you can see that on the right side, you can see the QRS recordings. They are just fluctuating because either the patient was moving or the ECG leads are not stabilized enough. But that's not our case. The point is that you can see the extremity leads even if you don't have any precordial leads, okay? But you can see obviously in precordial leads. So we are going to place these. Again, you can just try to memorize or you can learn to look. So there are some numbers here. You see 1, 2, 3, 4, 5, and the other one is 6. So, how it goes. Again, you find the sternal bone. This time, just remember the number 4, fourth intercostal space. The intersection between the sternal bone and the fourth intercostal space is the place where we are going to place our first lead. Okay, so the second one goes to the left side, just a mirror image. Then we are not going to place the third one, we are going to place the fourth one to the apex. and third one in between. You can find an imaginary apex and place it just beforehand, but that's the technique, so just know this. And for the two remaining leads, we should find the axillary lines. So there are no axillary lines, they are imaginary, but you can just find it like this. So this is the axilla, this is the anterior axillary line, this is the mid axillary line. And for knowledge's sake, I'm going to tell you this is the posterior axillary line. We use it for additional leads that we sometimes use. I'm not going to tell you these ones because it's a little bit complicated. We use them to diagnose some condition called the posterior MI, but forget them. So basically we've got these lines. So I'm going to place this fifth lead to the anterior axillary line. Again, fifth intercostal space. The ribs just make an arch, so the intercostal space also makes an arch. And the sixth one, mid-axillary line. Okay, now everything is ready. I'm going to press this button and see what happens.
So the fourth one, the jump should be in the fifth intercostal at the apex.
Apex, it's apex. It's the mid-clavicular line, fifth intercostal space, just apex.
Okay.
Okay, so we've gotten this time clear ECG recording, you see. The first thing that I want you to check is whether the patient's name is on it. So you can simply enter the name here using the device, and sorry, I don't know how to enter the name to the device. Or you just get a pen and write it down, okay? Always write down name, surname. Sometimes I prefer just writing down other personal info like the citizenry number or other things, because well, there are some common names like Mehmet Ali in Turkish. This is very common, so you can have multiple patients with the same name. You can try to write down any additional identifier, dates and hour. So these are important. Sometimes we get serial ECG measurements, and if you want to check which one is first, which one is later one, you need some kind of date and time. Okay. So you got it. You check the paper sweep speed. It's located here on the right side. And the voltage. This should be 25, this should be 10. So, if it is not like this, what happens? Let's try to see. I'm going to change these things.